I guess mainly Europe. I don't know how you guys that just have like insurance.
I'm in the UK, and the way it works here is that you have a doctor's surgery that serves kind of a ratio around the surgery. So a little bit like the school system works in America. And if you need to see the doctor, some surgeries let you call in, and other surgeries, yeah, I think they all let you call in actually, but you can drop in and ask for an appointment. Then you're seen by a doctor. If it's something that really bothers you or that really needs to be seen, like for instance, if you're bleeding, or if you have a mole that might be cancerous, then anything like that is considered an emergency. And I think there's a 3-week period where you are then referred to a specialist. And at that point, the specialist is going to run tests and get all the process going. It can sometimes be a pain, especially if you are going to the hospitals, because it might need quite a few hospital visits. I'm with an online GP, so my surgery is kind of it's kind of online, and if I need anything, like you can see my videos about my pap smear, if I need anything, then there is certain centers near us that we go to and get our tests done, or bloods, or whatever it is that we need. But you're right, we don't deal with insurance companies. You can, however, have a top-up insurance if you want to just be seen in prettier surroundings. But really, the doctors that operate for private insurance companies are the same that operate for a national health service. So it's a bit of a nice to have, but it's not that critical. It does allow you to have less waiting time. The private insurance will do that. So from that point of view, it's good. And also, if you have a problem that requires you to go to the emergency department, you just go. If you need to call an ambulance, you call an ambulance. And in fact, I had a friend of mine from America that came on holiday, and she came down with some kind of a stomach condition. She ended up in an ambulance, telling the people in the ambulance to not put the blue lights on, because apparently it costs more in America if they do. And they thought she was hilarious. And when she left the hospital, after I think she stayed in for 2 nights actually, and she asked where to pay, and they looked at her like she was psycho, and she's a little bit so. But yeah, so we do not pay for our health care. I think that because I had a private room when I had my children, that cost me about £150 for the 3 nights. Yeah, it's a much better system.